We've just started recording. Again, if you could just sign in the chat, that would be great. Put your email address so we just know you're here for the minutes. Hi, Christine.
Hi, everybody.
Hi.
Sandra.
Sí,
¿Sí me oye?
sí, aquí te escucho.
Ah, ok. No, es que no
Shall
le
we
oía
get
porque-
started, Rachel?
Bridget, do you have interpretation?
Pardon?
Are you guys gonna have interpretation?
No, I'm sorry, we don't have that yet. It costs like almost $80 a month to be able to have that feature. And so we don't have it yet, although I understand there's something in PowerPoint that we can work with, but we don't have it set up yet. I'm sorry.
Also, Google Translate. If you download on your phone the app, Google Translate, or if you have your laptop up, anything that can listen in on, and it'll you can have it working while we're in this meeting, and it'll be popping up the translation as we're going. I cannot speak to the how valid it is or how close it is, but it seems to be talking mostly about what we're talking about usually. So, but
Could you
yeah,
set that up, Rachel?
you go to Google, you go to your app store on your phone, wherever you get your apps, and it's Google Translate.
Okay.
It's a Google product. It's
So
free.
the people who want it translated can set that up.
They would put that on their phone. And so right now what they would do is that while we're in the middle of the meeting, they would put it up, and then they could be reading, they'll hear what we're saying. It'll hear what you're saying. And then it pops up the Spanish translation in real time.
Okay, shall we get?
So before you go, Bridget, let me just talk to Sandra. Hey, Sandra, la persona que tiene, usted sabe, yo hablo español, así que si tiene preguntas, te puedes pasar mi información y después me las envía.
Lo que
Y
pasa es
yo
que invitamos a 2 personas de la comunidad que son parte del Consejo Comunitario que hablan español solamente. Tenía entendido que iban a tener interpretación y es por eso que estoy preguntando si hay interpretación solamente por las 2 personas de la comunidad.
Okay. Pero de igual forma, o sea, ellos no tienen interpretación. Lo que está diciendo es que puedes bajar una aplicación a través del teléfono, Google Translate.
Yo sí lo tengo.
Ok, pues para las otras personas. Pero anyway, dale, le puedes
Ya.
pasar mi información a las otras 2 personas y si tienen preguntas, se comuniquen conmigo luego también.
Ok, gracias.
Okay.
Thank you, Jesse.
Well, that just translated everything they said into English, which I just read. It's kind of interesting. I didn't know I could do that.
Oh, with the Google Translate? Cool.
Yeah, well, I didn't know I had it. I mean, it it did it. And I'm like, well, what the heck is this down here? And it was everything that they were saying, and they translated everything. So I hear you, Jesse.
Rachel, shall we get going? Because we
Yeah,
have sort of a full
let's-
schedule.
We can go ahead and get going. Okay. Oh, okay. So can somebody please get in touch with Sandra and connect on that so that we can keep moving? Thank you. Okay, so the first piece of what the first part of what we're going to do is, and I thank you for putting this up here. The land acknowledgement, that's really beautiful. I'm not equipped to give one, but I think it's important to put that forth and to kind of just acknowledge that we're on stolen land. And then, so the first thing that we're going to do in the meeting is to talk about the institutional controls. That's been a big, big, big thorn in our butt for a really long time. We really tried to like get answers, get some understanding about this. So when OU1 was delisted, we were all kind of confused because, and stayed confused because there were yards that weren't remediated, land and they haven't been tested, and they haven't been, they haven't gone through the processes. And so we're kind of going back and forth, like, why isn't this? And then there's stuff about some folks are renters, some people are owners. And so there's just a lot of back and forth about how and why we have unremediated soils. And we have these properties that have never had EPA look at them or address them. There's words and nomenclature I may not be familiar with, but this is what I'm talking about, is that they haven't dealt with them in whatever way that they deal with them. And that there are people who need to have their soil remediated, and they need to have things done. And we're kind of out of the statute of limitations on some things. And so we're kind of sitting here going, well, stuff wasn't done, it wasn't finished. So now we're kind of at this point where we see that OU1 is delisted, even though it's not completed. And what do we do next? What's the next process? Is it to open a whole new OU? I don't believe that that we can reopen OUs after we've delisted them. I don't know if you can relist them. So kind of just understanding some of these processes to make sure that these yards get cleaned, and that the people who are living in these spaces get what they need. Okay, so there's that. There's sort of a basic, and there's information on the PowerPoint. So Jason King has come to talk to us about what, kind of give us an update, give us some understanding from his perspective about how this process has worked and what maybe what we should be doing in the future. Our own scientist, Chuck, is going to has actually provided a response to some of the responses about these OUs. So his information is really useful as well. So we're going to kind of have these two talk here for the next few minutes or the next hour or whatever about these institutional controls, to see what do we need to do, what's next in the process, because there's seriously a breakdown at this point. Jason, go ahead, take it away. Thanks for joining us.
Thank you, and thanks for having me. I'm Jason King. I'm an Assistant Attorney General with the Colorado Attorney General's Office. I've been working for them for about 17 years, since 2004. I noticed one of my old work neighbors is on the call, Joel Miner. Good to see you, Joel. So I represent CDPHE's Hazardous Materials and Waste Management Division and the various programs within that. So a little bit more on my background. About half of my caseload is working on these CERCLA Superfund sites. I work on both remedial sites and then the smaller, quicker removal actions. And I represent CDPHE's remedial program in its support or lead role in these Superfund cleanups. So I am new to this site, and when I say new, it's been less than a week. So I've done my best to get up to speed, but surely I don't know as much as you all. This site, though, from the research that I have done, it's very similar to some of the other sites that I've worked on in Colorado. So hopefully some of my insight from those sites will be helpful. And in particular, my experiences with institutional controls at those sites, as well as what's been happening here at this site. I'll try to help with any sort of understanding or misunderstanding that we have. And so please feel free to jump in with any questions or corrections if I'm getting things wrong, because again, it's been less than a week since I've been working on this site. So I thought I'd just start with a little bit of background to sort of work us into the issue here on institutional controls. So the I-70 site was added to the National Priorities List in 1999. Has 3 OUs. The one we'll be talking about tonight is OU1, and that addressed a geographical area which includes residential yards that were impacted from smelter deposition from as far back as a century ago. So the contaminants of concern that were identified in remedial investigation are lead and arsenic. Those are common constituents of concern in areas that are impacted by smelter deposition. And the first big decision document that came out for the OU1 portion was a 2003 record of decision. We call them RODs or ROD. So environmental laws and regulations are full of acronyms. We call it alphabet soup. So I don't blame you when you get confused when you hear all these acronyms being thrown out. So I'll try not to speak in acronyms, but it's almost impossible. So back to the 2003 OU1 record of decision remedy, what EPA selected and what CDPHE concurred with had 2 main components for the residential yards. The first was that yards would be sampled, the soils in the yards would be sampled for the arsenic and lead. And where those 2 constituents where levels were found above what we call action levels, then those yards would have the opportunity to be remediated. And remediation involved removing the top 12 inches of soil from the yard and replacing it with clean fill. So since listing up until the 2014-15 timeframe, thousands of properties were sampled and over 800 were cleaned up. So by 2014, there remained 50 or so properties that had not been sampled or that had been sampled, but the property owners had refused remediation. And when I mentioned those unsampled properties, those properties were unsampled also because those property owners refused EPA access to sample the properties. So around 2014, the OU1 remedy made this transition from the sampling and the yard remediation into a phase where it was more needed focus on providing notice to property owners or tenants or prospective purchasers that there were conditions on these properties, these 50-some properties, that were cause for concern. In other words, they could have lead or arsenic above action levels because they weren't sampled, or they were sampled and they in fact do have those levels, but they were not remediated. So what happened in 2014 was the record of decision was modified. Okay. And this is something that's quite common in the Superfund process. As cleanups evolve, certain mechanisms need to be added or modified or tweaked. And at that time, it was decided that institutional controls would be added to the remedy. So institutional controls are a fairly confusing concept, and I'll try to help you out with this, but they're essentially mechanisms that complement other components of a selected remedy that will further reduce the potential for human exposure to contamination. And they really do it in two different ways. Sometimes it's both, sometimes it's one or the other. The first way is to provide notice or information to people that are potentially going to come into contact with that contamination. So in this instance, it'd be notifying a property owner or a tenant or a prospective purchaser of that property of those conditions. The other way an institutional control helps complement a remedy is to provide actual restrictions on the land. And those come in many different forms. They can be a governmental control like a zoning law or an ordinance. They can be what's called a proprietary control, which can be an environmental covenant or a restrictive notice that's actually recorded with the property that has specific use restrictions. You cannot dig into the property. You cannot produce groundwater. There's also administrative institutional controls, which would be an administrative enforcement order or a court order that provides those restrictions. And the last mechanism is called an informational device, and that's what was selected here as an institutional control. Okay, and that institutional control here has two components. So the first is a deed notice, and that is a document that describes what's been done with the Superfund remedy, the fact that the property was either not sampled or sampled and exceeds the action levels, but it is recorded in the property's chain of title through the county's property records. The city and county of Denver uses what's called a grantor-grantee index. I'll get into more on the index in a bit, but the big thing to know there is you can't just type in a property address and see a list of documents that have been recorded in the property. You actually have to use what's called a grantor or a grantee that was identified when that document was recorded. And the second component to the informational device I see was this annual letter that would be mailed to property owners at the address of the property and to the address of the owner if it was different than the property. So again, this is what happened in 2014 when the record of decision was modified. And this is the institutional control layer that was added to complement what was selected as the remedy. Under CERCLA, it is typically, well, actually it is always for fund lead cleanups where there is no responsible party paying for the cleanup. For fund lead cleanups, CDPHE or the state entity in other states is who implements the institutional controls. In other words, it's CDPHE's obligation to make sure those deed notices were recorded and those annual letters are going out. So fast forward to 2019, we had the third 5-year review for the OU1 remedy. Another requirement of CERCLA, if a remedy leaves contamination in place that is not appropriate for unlimited use or unrestricted exposure, in other words, it still poses harm, then EPA has to review the remedy for protectiveness every 5 years. And so that will happen in perpetuity at this site. And frankly, most remedial sites that I'm aware of do leave waste in place. And so they also have this 5-year review component every 5 years. So in examining whether the remedy is still protective, one of the things that was done in 2019 was to look at the institutional controls, see if they are working and they are functioning as intended. In other words, are they actually notifying property owners and tenants and prospective purchasers about the conditions of the property? And what the 2019 5-year review concluded was that yes, the remedy was protected, and yes, the institutional controls are functioning as intended. However, it did have some recommendations to further enhance the institutional controls. The first recommendation was to send a letter, the annual notice letter in Spanish, which made a whole lot of sense based on the demographics of the impacted areas. It also had a recommendation to do some further evaluation whether these deed notices were actually discoverable in the Denver database of property records. But it did have some confusing language in it that wanted to focus on the fact that some of the ICs, and I'll just quote it here, they were filed by property owner name and may not be found. That statement is confusing, it's misleading. Reason being that all property records are filed by a property owner's name. That's how you do it in a grantor-grantee index. So I think some of the confusion on what was being done here in 2019 can be attributed to this poorly worded language in the 2019 5-year review. In May of 2020, EPA had finished its evaluation of the ICs and provided a memo dated May 2020. I can't remember the exact date. It provided an update on first on some of the properties were actually cleaned up since the deed notices were put on, and I think there were 6 or so properties that had been sampled, and the samples were below action levels, or they had been cleaned up. Either way, they didn't need to be on this list of unremediated properties or unsampled properties. And so a process ensued to remove those properties and the notices on those properties. It also identified a couple properties that had changed ownership, but I think one of them actually was withdrawn because it was sampled or remediated. So really, there was just, according to this memo, 2 properties left that had changed ownership and would give cause to look further into whether this notice it would be provided to the property owners. The memo also had additional recommendations beyond what the 5-year review recommended. The first being that where CDPHE could identify a new owner for the property, and that would be from looking at the property tax assessment records in the city records, that annual notice would actually be sent certified. So whoever received it would have to sign for it, and that certification gets mailed back to CDPHE that confirms that somebody at that property received it. Another suggestion was to include what is referred to as a reception number. It's about a 10-digit number that attaches to that deed notice. So in addition to searching the property records by a property owner's name, you can do a separate search by plugging in this reception number. And if you plug in the correct reception number for a deed notice, the notice just pops up, and it's the quickest way to get to it. And then last, it reiterated that recommendation to send the letters in Spanish. So finally, a couple weeks ago, actually about a week ago, myself and CDPHE reviewed EPA's 2020 memo. and did a little test of our own, and in fact went through all 50 or so properties that had the deed notice recorded in the chain of title to see if we could actually get to that notice. And the notice was discoverable using the name of the owner when the notice was recorded in every instance except for 5, okay? Interestingly though, the 5 that didn't show up were because of a clerical error at the clerk and recorder's office. They had recorded those deed notices identifying EPA as both the grantor and the grantee. So they didn't use the property owner's name as the grantee when they recorded it. Human error, these things happen, but rest assured, I had my paralegal contact the clerk and recorder's office, and all 5 of those properties are now recorded with the property owner's name as the grantee. So they will come up when searching that online clerk and recorder's database. And if for your records, if you want to know, it was 3351 Gaylord Street,
Okay.
and then 4 properties on High Street, 4675, 4677, 4679, and 4685. The last thing that I did looking into the IC's issue was I reached out to a colleague in the AG's office who is sort of an expert in property law, does a lot of title searches and record review. Definitely not my area of expertise, which is why I reached out. I have reviewed title searches and title commitments on other sites. So I am familiar with how extensive they can be and how far they reach back and how much information they provide. And in my experience, and which was confirmed with my colleague, title search results are comprehensive. They are going to list all prior owners and all encumbrances over the years. And I've seen these reach back, into the early 1900s. This is why a professional title search is so expensive. It actually takes a lot of time to piece together who owned it, when they owned it, what property interests were granted to them, what property interests did they grant to other people. But essentially what a title search is going to do is it's going to piece together that chain of all the property interests that are associated with that property over time. So after doing all this work and conferring with CDPHE, the conclusions that we reached were first, that the institutional controls at this site are indeed functioning as intended, albeit they are not perfect. I've seen some of the issues that have been raised by the community, sort of shortfalls that they're seeing in the institutional control, and we can certainly talk more about those. But with regard to whether the deed notices are discoverable, they are. They are certainly discoverable and will show up in a property title search that a professional has conducted. And so that would serve to notify these prospective purchasers who are considering purchasing the property about the condition through discovering the deed notice in the title search. And then also, if anyone has that 10-digit reception number, you can go on the CDP or the City and County of Denver's clerk and recorder database, plug it in, and the deed notice will show up. And last, if people have the name of the property owner when the deed was recorded, and that was in 2015, then that database is also searchable by the property owner's name. With regard to the letters, the conclusion is also that the institutional control is functioning as intended. It is informing current occupants of the property, whether they're tenants or their owners. The recommendations from the 5-year review and the EPA memo will only enhance this notice. It's going to address the language barrier by providing the letters in Spanish. It's also going to ID when property ownership has changed and really ensure that that notice was received, that notice letter was received through that certified letter. So really the only gaps here I perceive are when a property is purchased with no title work. And really the only time you would see that is if a prospective purchaser is going to purchase with cash. They are not going to take out a loan. If they were going to take out a loan, then the bank would most certainly require that extensive title search where the notice would show up. And a second gap would be if a tenant moved in, that period of months before that annual notice letter was mailed to the property. There'd be that short gap in time where they wouldn't have notice of the conditions. So that's it in, well, I can't call that a nutshell because that was a lot of information, but I think this is a good time to pause and invite some dialogue and answer some questions. So
Thank you. Thank you for all of that. I don't know if anybody has one just to start off with that wants to go first. I think Chuck was kind of our primary here to kind of vet some of those concerns that he put in his response. Chuck, can you hear us?
Yes, I can hear you. Can you hear me?
Yes, sir. Loud and clear.
A couple of observations. One, I've read both the EPA's memorandum of May 19th, 2020, and also the document that Fonda put together here a couple weeks ago or this week. And what I just heard described, and I would argue that the need for protection should always be the controlling aspect of it. It was asserted this evening, but it was mixed with whether or not the actual performance of what was done matches what the ROD said was going to be done, not whether or not the performance is actually protective. And I would argue that that's where the problem lies, is people can live at a property as a renter for 360, up to 364 days, and not receive a letter that might give them pause as to whether or not they should have rented there. For some reason, the EPA's recommendation, 4 recommendations, 2 related to language and 2 were related to the existing practices with the notifications. One of those was that the registration number, the indexing number that was mentioned, be included in the letter to the owners and the occupants of the property. And for some reason, CDPHE decided, no, that's not going to be done. The reality is that number is the only way to find those documents with certainty, unless, and in this case, I'm discussing from the standpoint of a potential buyer, unless the potential buyer is aware there may be such a document on this property and knows that he needs to look for that document under the name of someone who owned that property 5 years ago or 6 years ago now, but 10 years from now, it'll be 15 or 16 years ago, in order to find that document himself. And there isn't right now anything that's going to that is going to inform a potential buyer that that's the case. Now the issue came up of a full chain of title purchase. We'll find that. The reality is most residential properties that are sold, even with a mortgage, does not have or pay for a full chain of title all the way back to the indigenous population that owned the property. That is, as was pointed out, a very expensive effort to go to and to develop, and takes people who are extremely sophisticated to do it the right way. What is done and what mortgage companies accept and is typically provided for somewhere between $1,000 and $1,500 is a title policy. And that's acceptable to the mortgage company. That's acceptable to most buyers, and it's almost a worthless document. I've paid for way too many of these things. They are a cursory examination at best that seldom goes back and lists owners prior to the owner you're buying from. It lists a lot of documents that are readily achievable, but primarily achievable through records tied in databases to the property, not to present and past owners. That's where it starts to get expensive. And it carries 2 to 3 pages of exemptions that are not covered in this review. And those exemptions on those documents are what are missing that would allow a potential owner to, with certainty, know whether or not there was such a document filed in 5 years ago or 15 years ago, or at what point it's doing it. Now, if you go in as an attorney or his directed paralegal, knowing who the owner was at the time the document was filed, then in fact, 90% of the time, you can find that person because you know exactly where it is, who it is you're looking for, and at what point in time you're looking for it. You also discover the first time you do this, apparently, that about 10% of the time, it wasn't done the right way and has only recently been corrected. Now, did the agencies do what the words were that were in the ROD and what they said they were going to do? Sure. Just like the physical remedy did what it said it was going to do, if you find contamination in the top 2 inches of the soil in somebody's backyard or front yard, you will scrape off a foot of dirt and replace it with a foot of dirt. That was performed as well. But that is still arguable as to whether or not that's protective. But that's what's in the ROD. The agency did what it said it was going to do. The agencies may have worded what they were doing such that technically, if you know enough going in, you can find what you're looking for. But to be protective, it has to be that in the normal course of human activity, a person can protect themselves from exposure to something they don't know is there. And I would argue that these institutional controls, whether or not they're doing what they said they were going to do, in hindsight, I think it can be very reasonably asserted that they need to be modified so that the average Jane or the average Joe who's scraping together enough money to buy a piece of property and try and get some generational wealth established for their family is going to know before they buy it, before they get the letter that says, oh, just to let you know, you may have a problem here. And what is intended or what was expected, the expectations need to be changed and the institutional controls need to be changed, because while they might be doing what we said we were going to do, they're not being protective. That's what I get out of the institutional controls on 01.
Thank you, Chuck. Christine, you had your hand up.
Yeah.
Go ahead.
Thank you, Chuck. And I'm not disagreeing with you on anything you said. You're very good at all this. You're way more in depth than I am. But frankly, in terms of your most important point, that it needs to protect people who rent or live there, I would like to put EPA on the spot on 2 questions. Well, first of all, I know you're not the EPA, and I am wondering, since the EPA wrote these, why we have CDPHE addressing the question. But 2 questions. Does the EPA ever take it into their own hands to do what's right, even if it wasn't done originally? And secondly, what other kinds of things could be done instead of just fixing the institutional controls and getting it recorded right and all the things Chuck was talking about? Are there other things under proprietary controls or zoning or land use protections that would be more protective? And have you thought about that?
Joan, I'm gonna let Joan ask her questions, and then Jason, then I'll have you respond to all of them. If that's okay. Go ahead and do that. Go ahead, Joan.
I just going to do something very quickly, which is, Jason, you are brand new to institutional controls. Is that correct?
No, I'm brand new to the site. I'm familiar with institutional controls since I started working at the AG's office, and most of my sites that have remedies implemented have institutional controls.
Are they institutional controls that involved residential properties?
Yes.
How did you apply institutional controls with properties? Were they Superfund sites? Were they just RCRA sites with some contamination? Was there anything that was comparable to what we're dealing with now? That was my first question to you, but you can hold for a minute. This has been an ongoing situation since the record of decision was written in 2003. The first record of the first review identified that there was a problem with institutional control. So that was EPA's, not CDPHE's problem. This was EPA. If you look at a timeline, and it would be really nice, Jason, if you could present a timeline from what you've learned about this particular site and why that's been extremely problematic, is that, again, this has been a Superfund site since 1999, but the record of decision was written in 2003. There was a lot of action and activity just prior to that. And so there were a lot of properties that had contamination, and there are some folks who were pretty concerned because their properties never showed up on the final record of the final D list. But what I'm asking right now is Bill Murray, who was the EPA representative in 2008, and he produced in 2009 an update, again, requiring that they address the institutional controls at that time. And in that particular report, it said that Denver was given a grant to track this information. So it'd be really nice to take a look at again for Denver. Denver does have the ability to track. They have a, and I don't have the doggone name of that document, but it is a ordinance that Denver passed with the radium sites, and they can absolutely follow institutional controls. They currently have 80 parks that are listed that have covenants, et cetera. So Denver isn't they know how to handle this if they had wanted to handle it. So I was wondering if we can, again, look at Bill Murray. Why did he say that Denver was given a grant to actually follow this? The one thing that we're seeing over and over, and I'll cut this shorter, is that Denver, I'm seeing the EPA came into this site with the decision that there would be no PRP. That so EPA took control, CDPHE would take operations and maintenance. And that operations and maintenance document was produced in 2016, and I'm not sure if you've seen that, where it was the final decision of how operations and maintenance would occur. And so I guess what we're seeing, and we know that the 2019 Third 5 Year review listed a lot of addresses publicly. They're listed, and a research that was done by, research that was completed by the CAG, Bridget Walsh did an excellent job. We found out there were a lot of properties that had already been sold. So from the very beginning of this, institutional control should begin at the cleanup beginning. So at this point, we're not quite sure how they really documented, because it was a problem. But I'd like to have you help me on, are the houses within a Superfund site where EPA in 2014 said they would never pay for another house to be cleaned up? They had their chance. That was the 2014 EPA explanation of significant difference. They said it was over for them to be paying anything. And then because they'd already sent letters out and tried to contact the community renters and the people. Do those people that own the properties now, are they considered PRPs now in a Superfund site? And that's, EPA has identified all of these issues. And that is something that at this point, the way we're handling this institutional controls is that now those property owners that have slipped in and slipped out are now responsible for the payment the cleanup, etc., with just, you know, a little accounting that goes on if it is or isn't handled correctly. And so, and also the 2019 report, the CAG never had an opportunity to really get down and discuss how does this all work. We asked the EPA to help us understand how Denver was supposed to do it. We haven't gotten a clear response from Denver as to did they receive a grant, and the last thing we heard was the last thing they ever had heard about was the 2014 explanation of significant difference, etc. So at this point, are the renters and the homeowners at risk? Future buyers at risk? Could EPA have unilaterally done something about this? And so that if I was a homeowner in that particular situation, I would be concerned to get that letter. And at this point, are they now just like any industrial commercial person in a Superfund site? This is Superfund. Is it EPA's responsibility to make sure that no one is being exposed? Because those letters that are going out now, they absolutely confirm, well, there is an issue, there is a problem. And we now know, Jason, that Pueblo is in the middle of no D list, and they're having an EPA list kind of tracking, but the community is still concerned about their neighbors who are getting their properties cleaned up. And the owners or these renters are concerned because they're not getting cleaned up. So this is a snowball issue. And that's why I ask you, have you been involved with residential issues with institutional controls? And this has been an issue with this site since 2003. Actually, 1999.
You have your work cut out for you, Jason. We have
Yeah,
so please start writing your dissertation. Yes.
I was taking good notes.
Good.
I'll start with Chuck. First thing to respond to Chuck's comment on the reception number and whether that's included on the annual letters. And I actually just confirmed this right before the meeting, that the letters that went out in 2021 all have the reception number that have deed notices recorded against them. So that was addressed, that's being implemented. Chuck, your comment that tenants can go 364 days theoretically and not have notice that the property they're living in either was unsampled or sampled and not remediated. That is an accurate statement. And the way that the IC is set up, again, it is not perfect. No IC is perfect. I challenge anybody to find one in the United States or elsewhere that is, okay? That scenario is possible. However, on day 365, they are going to get that notice letter. And now that notice letter is going to be in Spanish and it's going to have the reception number. So the database search is much easier with that reception number. And so that's what the IC is providing for a tenant. As far as the property potential purchaser, I can only go on the information that I've been given by my colleague who I conferred with in looking into all of this. And she assured me that the title product that is produced in a purchase of residential property is going to produce the deed notice. It is going to be discovered by the person doing the search. And then whether the realtor flags it and explains it to the buyer, I'm not sure what happens there. Let's see. Moving on to Christine. Very good question here. What about those other controls that I described earlier in my presentation? Are those available here? The answer is it depends. Sorry to give a lawyerly answer here. you know, the first one I will talk about is the local land use control, the ordinance or zoning law that can be passed by Denver or any other municipality. Is that an option here? Yes, it would be. I don't know if there were any discussions with the city and county of Denver about this option. However, that option is not going to provide the notice that you're looking for, and the issue that has been identified in a tenant or a prospective purchaser being notified that the property is contaminated. Local land use controls aren't going to do that. They're not going to have that notice component. They will have the use restriction component, meaning properties that have not been sampled or remediated, there will be restrictions saying you cannot dig, you cannot plant a garden, you can't do activities that would risk exposure to the existing conditions. The other mechanisms, so the proprietary mechanisms are what's called environmental covenants or restrictive notices. Colorado has a specific statute that addresses these. And it's a very, very useful mechanism. We use it in quite a few instances, not only in Superfund cleanups, but also other waste contaminated areas. However, it hinges on the property owner consenting and agreeing to put that environmental covenant or that environmental use restriction on the property. So again, that's not going to be helpful here because my understanding is these property owners are not willing to have the sampling or the cleanup. And it is very safe to assume that they're also not going to want to then grant a notice that's recorded in the chain of title that they consented to. Let's see. Moving on to Joan.
Wait, how about, does the EPA ever of its own volition do the right thing?
Oh, I work with EPA quite often, hand in hand in these cleanups. They are complex. I'm not gonna give you a specific answer because I think it's a loaded question. But I can tell you in my experience that I think they do the right thing, they do the best they can with the tools that they have for very complicated sites. And one of the things that complicates cleanups, in my experience, is property owner willingness to cooperate. And this is not the only site where we have residential property owners that really don't want what they find to be intrusive sampling of their property or cleanup. They just don't want it. And the fact is that in the United States, property interests are highly valued and they're protected. And it's not easy forcing a property owner to do something that they don't want to do with their property. So that's the unfortunate situation with these 50-some properties. There were property owners in Leadville that didn't want sampling. I'm sure there's property owners in Pueblo that don't want their properties sampled. And then it is really, how do we protect the people that are living in those properties without the sampling and without the remediation? And it is a challenge, but using these institutional controls are one way to sort of add that layer of protection without the sampling and without the remediation. Okay, on to Joan's. Joan had some very good questions here too. Yes, sites similar to VB I-70. So I mentioned the two already. That's the California Gulch site in Leadville and the Colorado Smelter site in Pueblo. In Leadville, so the institutional control for the residential areas was in fact a county ordinance. So it's that local land use law that imposes restrictions on properties that were unsampled or unremediated. But as I explained before, it doesn't have that notice component that we've been focusing on tonight. There's nothing done in Leadville as far as annual notice letters. There's nothing that I'm aware of that's recorded in the chain of title. So if what's going on in Leadville is addressing the, hey, let's restrict the uses on these properties, but it's not addressing the notification to inform people that the property is actually contaminated. Then Joan asked about a timeline for the site, questioned some pre-2003 work. Again, new to the site, I'll do the best I can, but my understanding is prior to the 2003 ROD, there were these smaller, more discrete removal actions that were occurring. So under Superfund, you can have a remedial action, you can have a removal action. There's different processes for selecting and implementing them. But the removal actions are intended to be able to get on the ground and do work quicker. So my guess is while the remedial investigation was going on, that EPA also performed these removal actions, maybe doing some discrete investigation work and saying, yes, property contaminated, let's get down and get this property cleaned up. So there was a number of properties that were cleaned up pre-2003, pre-ROD as removal actions. And that's all that I know about that. Next, Joan asked about Denver's tracking and referenced a ordinance passed for the Denver radium site. I'm aware of the site, but I don't know it well enough to, well, I didn't know that there was an ordinance there. So I'd be interested.
Can I interrupt really quick?
Yep.
I believe Joan's referencing the LUCIP program,
Oh,
land use
okay.
control and implementation program that was set up for Denver Radium and is also applied to the VBI 70. So if you want to talk about that, you can, or I can.
Yeah, sure, I can talk about it. So the LUCIP program, it is a mechanism to notify property owners of conditions on the property. LUCIP stands for Land Use Control and Implementation Plan. It's only triggered when somebody proposes to do something on the property, like a development project.
That requires a permit. Anything that requires a permit will trigger the program. CDPHE gets notification, and if we have concerns, we talk to Denver. Fonda, feel free to jump in. You deal with LUCIP more than I do, but that's the general outline of the program: is permit activities cause notification to CDPHE, and we confer with Denver on whether it's an issue. And there's any permit, even electrical permits. So there's often permits that are pulled that we're not particularly concerned about. So
okay.
Leave it at that.
Are these 50-some properties in the LUCIP for Denver?
My understanding is that they are. The VBI 71 area is included in the LUCIP program.
Okay. So that's another mechanism for notifying property owners of the conditions. If they want to do an addition, pop the top or whatever, if they put in for the permit, that property is going to be flagged as a property in the LUCIP, and those conditions will, they'll be informed of those conditions.
So
If
we're
I
kind of
can
in the
just
final. Oh, go ahead, Dennis.
I can just add, I think I was on city council at the time, and I remember there were lots of properties other than residential and business properties. They used the radium for street coverings. And so whenever they had to remove, fix the street, they had to let the people know that there's going to be radium dust floating around their house as they pull up the, and that, if I remember, that was unique, that I didn't realize that they use this for street coverings. Am I wrong on that?
No, they did use it for street coverings, and there's also for fill in certain areas also. But that's all been cleaned up through, that's all been cleaned up and closed up back in the late 90s.
Yeah.
Well, so Yadira had a question, and I think these are just two final wrap-ups that can be quickly answered. What if a property owner identified that they had not been remediated and they had been kind of slipped through the cracks or whatever the case may be, or they have elevated lead and arsenic in their yard. And could they we've been talking about people who don't want it, right? They're just like, I'm refusing this cleanup. What about people who want it and they like want to get that cleaned up? Like, how can they request the cleanup and make sure that it get it done? And then the follow-up question to that with, Jackie was talking about, like, how can we, I mean, we're the community advisory group. How could we possibly support in going and notifying people and being part of that solution, because people don't trust you. They don't trust official types coming to their door and, with titles, and they don't trust that. But they would trust maybe a community member that could say, hey, let me talk to you about this. This is something that's going on. Here's their information. I can't do the cleanup myself, but this is how you get it started. And making sure, back to Yadira's point, making sure that that's clear and able for folks to follow in English and Spanish. And then we'll move on.
Well, I'm going to respectfully defer on the question of whether new property owners who now want their properties remediated or sampled can ask the state or federal government to do that. My understanding is that that portion of the remedy is concluded. This is more into a operations and maintenance phase now, which is mostly ensuring that the institutional controls are functioning. But if someone wants to provide some clarification on whether a current property owner can get their property addressed by Superfund, by EPA or CDPHE.
So we need to move on.
Yeah. Hold on one second. I think we have somebody needs to mute real quick. Let me get that going.
Yeah, Roxy.
No.
Okay. Got it. All right. So.
Rachel, I think you're on mute.
I muted myself. I muted everybody. Too much noise. I need silence over here. Okay, so our next conversation that we're going to have, and at this point, if any of our organization people and our CDPHE, EPA, or any of our organization people want to leave, they can. This is our community section. So there's some questions about the upcoming health study that has been, and more importantly, the RFP and the study that was actually chosen. And thank you, Janine. Thanks, Jason. You're right. And so I wrote the committee because before the timeline, it might have been 5 minutes before, but I wrote them to let them know that I didn't feel that this study was appropriate. And the reason why I have some questions is the lack of transparency around potential conflicts of interest, and more so like that wasn't even thought of by them, that they wouldn't think forwardly enough to think about connecting these issues. So I'm just gonna it's just a paragraph. I'm not gonna go on forever, but I'm gonna read my letter so that for folks that didn't see it, and then ask them to respond to this, to my questions. Okay, so this proposed study is highly extractive and leaves the GES community with little justice. This proposal does not explicitly state how it will conclude accountability for pollution in GES per the RFP. Community members are data points and transactionally engaged for the purposes of creating a marketable product for CSU. The proposed study is not honest in divulging potential conflicts of interest. There is no mention of how researchers from CSU will navigate their institutional role, achieve authentic community engagement, and responsibly report data. The CSU Spur campus in Globeville is on polluted land and is mentioned as a potential space for the once a month office hours. The National Western Stock Show is home to the CSU Spur campus and is going to the ballot to ask taxpayers for more money through the 2E bond initiative to complete development. Much is riding on the bond money going through. A polluted campus would not be a great headline. Now, would it? I want more transparency around conflicts of interest and how it will actually benefit the community. I don't see much benefit for the community in this proposal. Okay, so welcome, Melinda. Thank you for joining us this evening. I appreciate your willingness to be here and let us ask you some questions and get some clarity around this. Just trying to understand this a little bit better. I think more than anything, again, I want this to be something that the community has they have a deliverable, they have something for them. And I'm not seeing that. And I appreciate.
How about introducing Melinda so the people will know who she is?
Oh, okay. I thought we did that at the beginning. I'm sorry. Melinda,
Yes,
hi.
that'd be nice.
Hi. Thanks for joining us. Melinda's going to talk to us today about this study, the proposal I just talked about. And she's from what?
Why don't you tell people where she's from and a little bit about her so they know who they're talking to or who they're listening to.
Bridget, there's the slide up here, and I'm happy to read it for people if they need that.
I don't know if people really need to know more about that. I'll just update you a little bit on that slide. And if I could share my screen, is that possible,
Sure.
Bridget?
Yes, yeah.
Thanks. Can you all see this?
No, there we go.
Okay, thanks. Yeah, thanks for the invitation and thanks for that setup, Rachel. That gives a lot of context for understanding what people want to know about. I prepared a short presentation to give some updates on where we are with the health study, and then we can address some of your issues. So thanks for this opportunity. I'd like to be able to give an update on the I-70 expansion settlement, the RFP process, and an overview of the next steps. I'd like to first introduce the steering committee to you, the GES Health Study Steering Committee. The steering committee is a requirement of the settlement, and it's made up of 4 members. And so I'd like to, first of all, I'm Melinda Laituri. I'm the independent member of the steering committee and was selected through an application process and vetting process that the existing steering committee underwent along with the petitioners. I'm actually retired from CSU. The document or the information says that I'm still at CSU. I'm not. I'm retired, thank God. And so with that, I'd also like to ask my colleagues on the steering committee to each introduce themselves. Megan, are you there? I think you are.
Yes. Hi, I'm Megan Geider. I am the petitioner's representative on the steering committee. So I represent the Colorado Sierra Club, Colorado Latino Forum, and Elyria Swansea Neighborhood Association. My background is in environmental analytical chemistry as well as community organizing.
Thanks, Megan. Andrea, did you want to introduce yourself, please?
Hi, everybody. My name is Andrea Kincaid, and I'm a toxicologist at CDPHE and the representative on the steering committee.
And Tristan?
Hello, everyone. Tristan Sanders. I'm the Director of Community and Behavioral Health at the City and County of Denver, and I have a background in public health with a focus in community health. Nice to meet you.
Great, thanks team. I was just going to mention as I start to talk about things, if there's something I overlook or you want to add, please don't hesitate to interrupt me. We're used to that by this point. So just a little bit of a reminder about the GES Community Health Study and what the settlement is. The settlement was a result of negotiations between petitioners and CDOT. $550,000 were awarded towards the health study to be conducted over a 4-year period. So thinking about this, what does the health study supposed to do? It will provide a data-driven assessment of potential causes of disparate health outcomes in Globeville, Elyria, and Swansea neighborhoods. Its proposed existing and or new data sources for the community health study shall be identified by the PI. The community health study will consider a full range of possible significant causes of these disparate health outcomes. And an objective of the community health study shall be to provide best estimates to the extent to which these possible significant causes contribute to adverse health outcomes in Globeville, Elyria, and Swansea. It's a tall order. There's two caveats with respect to the settlement that I think are important to bring up. The community health study shall not separately analyze the specific effects of the expansion project of Interstate I-70 as part of the settlement. The community health study shall not identify possible policy measures or make policy recommendations. So that's the context in which we're operating. So just to give you an update on the RFP process and what we've gone through this past year. An initial request for proposals was drafted and posted in August of 2020, and it remained open for 5.5 weeks. And the RFP went out to over 3,000 contacts. We received 2 bids that met all the minimum requirements, and a principal investigator was selected by the steering committee, and contract negotiation with CDPHE commenced on November 2020. The petitioners to the settlement raised important and compelling concerns in February 2021 regarding the PI, and contract negotiations were stopped in March. The steering committee then, working closely with the petitioners and interested community members, redrafted the RFP, reposted that in July of this year, and the bidding period was open for 8 weeks and extended for an additional week. Input from the community was solicited to ensure that interested parties were aware of the RFP. The RFP went out to over 3,400 contacts, and we received 1 bid. So with that 1 bid, let me just talk a little bit about this 1 bid. And we are actually kind of excited about it. Called CSU's team, the Environs team. And I had put what that stood for on here. Estudio de nuestros vecinos para investigar riesgos y nuestra salud is what Environs stands for. So I want to just highlight some of the things that about the team. The PI is Dr. Cheryl Magsamen. She's an associate professor of epidemiology at CSU. She has a joint appointment at Colorado State or Colorado School of Public Health. And just full disclosure, I know Cheryl, but I've not worked with her. There is no conflict of interest in terms of me evaluating her this proposal because there's no overlap between what we do. Another highlight of the team, I think, is Dr. Doreen Martinez. She's an Indigenous scholar who has conducted health equity projects throughout the world. She's in the Ethnic Studies Department. And the third person that we're very excited about, this is not the whole team, I'm just highlighting some of them, is Sarah Pinilla Montoya. She's the technical advisor. She lives in the area. She's a native Spanish speaker. She has worked with Tri-County Health Department. The team has a strong science background. They have experience with community-based engagement activities. They're familiar with the location. They've worked with Latinx communities and environmental justice issues. And if you haven't, but I think most of you have, I would encourage you to read the proposal. I think I take a little bit different view of the proposal than you do, Rachel, but we can certainly chat about these things. So that's some of the highlights from the proposal itself. Another piece of the community health study that from the feedback we got from the community in the past 1.5 years here now, the steering committee is decided to require the PI to work with a community council. And so this community council shall be composed of residents of the GES neighborhoods. And their aim is to work closely with the PI and steering committee in order to facilitate a relationship there and to recruit across the neighborhoods to have representation for the community council. And one of the major goals we'd like to see come out of this, hopefully, is to unite the environmental justice leaders that are in the community, to give voice to them and to have their issues prioritized. And after listening to the comments before this is an important issue to address. So the scope of work, we're in the incipient stages of determining this scope of work. We've only just identified the PI. CDPHE manages the contracting process as per the settlement requirements. And so between the PI and CDPHE and oversight from the steering committee, we've just now started this process of discussions with the PI to begin to identify what shall be in the scope of work. We do have some anticipated deliverables that we think will be available here, or that will come out of this. An integrated mapping tool of the existing exposure data, showing the site-specific locations. I know there's lots of stuff that has been done with this, but to organize it in a way so it's a comprehensive story of these sites is a critical aspect of this activity. Training and resources for the community council to communicate results to residents. The conducting of a data gap analysis that define the remaining research questions from the residents that will lay the foundation for targeted exposure studies defined by resident questions. The aim is to achieve community-based design with the establishment of the community council and to continue engagement with the community. Right now, we've been doing monthly reporting to continue the dialogue through the all hands meetings we've been having for the past year and a half here now. The Zoom environment, particularly challenging to do this, but has been effective in some respects. And then to just kind of give you some next steps. We certainly invite the I-70 CAG members and any other interested parties to attend the GES health study monthly meetings to obtain more health study details. In fact, we're having our GES health study all hands meeting tomorrow night. Similar presentation that we're doing tonight, we'll be doing tomorrow night for the residents and the people who attend that meeting. It's at 5:30, and I'm sure that many of you were coming to those meetings before the pandemic, before the slowdown in this process. So we invite you to come back and re-engage and discuss these important issues with you. This is a pivotal moment now where these meetings will become more substantive and have more things for us to discuss. And so this meeting tomorrow night, we anticipate a more in-depth discussion of some of the things that to address with respect to the community council, the types of meetings we're going to have, and how we navigate forward in terms of giving good guidance to CDPHE with respect to the content of this scope of work and what needs to be in it. Just an FYI for everyone on the call right now, we do have video and audio recordings of our past meetings in this master folder. I'll make sure you can have this link here. The video and audio are both in English and Spanish for you to be able to review them. If you have any questions of any of us, please contact us at this Gmail here, or I did provide my email in the chat if you want to reach out to me. And then also, this is an exercise in exploration to make sure we do a comprehensive job here. And so if you know of any ongoing work occurring now in the community, please tell the CAG leadership or email us so we're sure that the PI is aware of these things. Before I open up for questions, I just want to ask my partners here if they have any comments or anything they'd like to add to this.
I think that was great, Melinda.
Okay, thanks.
I think my internet might be breaking up. But yeah, I think, Melinda, you did a great job. And particularly with the last statement, we are aware that there's ongoing monitoring efforts in the GES communities. And we are specifically trying to make sure that that data also gets roped into the aggregate analysis that the PI is meant to do. So we are in no way trying to limit them only to looking at existing data, but both existing and ongoing data that's being collected in the GES communities.
So with that, I don't know, Andrea, did you want to say anything?
No, that was excellent. Thank you, Melinda.
Okay, thanks so much. So with that, I'm going to open it up for questions, and the entire steering committee is here to take your questions and respond.
So just on like a question we got in the chat, and then I'll move on to something a little bit different. Because I don't know that any of the questions or any of the concerns that I raised in my letter were cleared up by that presentation. So the first question, and I think this is a really valid one from the chat, Angela's asking about the community council and how are you going to recruit them? How is it made up? What's the makeup of it? And I think I remember from the proposal, isn't there $6,000 for the 3 years of the study that's supposed to go to the community council to support it? Like that's out of the $550,000, $6,000 goes to that, and it's, or no?
Andrea, could you talk about the pre-PI funds that CDPHE wrote to CDOT about?
Yeah. So in fact, it was the steering committee wrote a letter. We requested an early release of the settlement funds so that the community members that were participating in planning the upcoming bus and walking tour, we would be able to help compensate them for their participation in all of these planning efforts. And so we sent this letter to CDOT, and they approved the release of these early funds. And so actually in the RFP, we removed those funds from the available funds, since those would be accounted for right now in the participation of those community members.
So you've already, oh, go ahead, Tristan, sorry.
All right, so $6,000 is actually what was released from the settlement early and has been spent in working with community members already. There's a whole chunk of other funds that were in the budget that the PI submitted as part of their proposal to support community members and the community council over the course of the next 3-4 years.
Okay, thank you. So that 6,000 is gone now.
Well, it's being spent currently. Yeah, so it was to support community
I'm not
members.
saying you threw it away.
No, it's being spent currently. It's not totally gone. We are still working with folks from the community in designing these bus tours. It's spent prior to the PI coming on. And there's a whole other pot of funding that is a part of the PI's budget to then pay community council members during the course of the study.
Okay. And but they did that voluntarily, right? Like they put that into their proposal.
So it was part of the RFP that we requested that there be compensation for community members participating in the study. So yeah, it was up to them how that was like structured and designed, but it was a part of the RFP to request that, yeah.
Okay. One final about the community council. Angela asked if the GES would be represented, so there'd be equal representation between the 3 different neighborhoods, or if what your plan is for that.
So the intent is that we would have representation from every neighborhood. We are still working through the details of the community council with the PI, everything down to what is the recruitment strategy? How are we going to ask people to participate? How are we going to pay people? I mean, this is all in the sort of early stages of working through those details with the PI. And that's also the reason that we are inviting people to come to these meetings that we're having monthly tomorrow to discuss what would be the best way to ask people to participate on the community council. How could we get more people from these different neighborhoods? How can we engage people in this process? So that will be a part of, when we put the contract together, but it's not fully decided yet.
Bridget, do you have something about the community council?
So I want to know, what are you going to study?
Oh, okay. Hold on. I have kind of a question about that too. So anything else about the community council makeup before we move on?
Oh, I just wanted to add that if there is any of the residual funds from that early release, if there's anything residual from that, if it's not all spent before we execute the contract, that will all go back to the study funds. And so it will be addressed or accounted for, I should say.
Thank you. So thanks, Bridget, because that's really the big thing here. Like, I read through the proposal, and of course I didn't do like a deep analysis, but I read through it a couple of times and talked it over with Ian a few times, and was really trying to understand what the deliverable is. And legitimately, it's what I've understood this study to be, or environment. And let me first start with my critique of this study is not going to be a critique of the researchers and the experts that you talked about. I am completely, like, they're experts in their field, and they do a good, they know their disciplines, they know their information. So I'm not critiquing them. They're great. They're fine researchers and academics, totally. I'm critiquing what the product is. And from what I understand, it is the first thing is we're supposed to be finding causality. We're supposed to be able to figure out after this study, where did this come from? What's the reason for it? And from what I understand is that there will be a website where it's sort of like a data dashboard where they're going to collect different sources of data. So this is already existing data from CDPHE, EPA, other places that we've already heard is, quite frankly, distorted. Like, we've heard from EPA whistleblowers, we've heard from CDPHE whistleblowers that some data is completely distorted and has been fabricated. And so, first of all, we're starting with some data sources that don't seem that trustworthy. And they're going to collect them and then talk to the community about how to use this website. And so the product, the actual deliverable product, is this thing called environs, which the CSU gets to keep and have in their possession. And it will be public, obviously, but proprietary and all those other things, that's going to be owned by CSU. And so as you're collecting data and trying to find causality, we have right here next door the CSU Spark campus. And there's lots of contention around this property development. So, and I didn't see word one about any of this, like we have a new campus there. Finding some pollution in this area could cause some problems, right? Could cause some problems for our college in developing this area. And so we didn't get any of that. We didn't get like, hey, we acknowledge this. This could be a problem. So what we have is we have a website platform. That's what they're making. And then we have the potential for information to be silenced and not brought forth about the pollution that's there, because it would influence the possible development, or it could be minimized. This stuff happens. We've seen it happen already in different areas. And so those are my concerns. And I didn't hear any answers to any of those yet. Oh, Angela asked, what is you're on mute, Christine. I just wanted to.
We'll take Angela's first.
Okay. Angela said in the chat, what is the GS community supposed to do with the data on the website when the study is done? That's one question. What is outreach to GS community to know about the monthly meetings? What does that look like so far? Those are two of Angela's questions, and then we'll go on to Christine.
And then I was just going to add, I think CDOT got away with murder in the settlement, $500,000 to build what they wanted to build. And there's all sorts of problems, but I don't see that the people who are here today have any ability to get more than the 500,000 or whatever that grant was, and to do more than is contained in the settlement. I may be wrong. I think there's all sorts of problems with National Western. I just don't think this group is the ones that's going to be able to address it. We're going to have to keep doing our work, but I may be wrong. That's just what I'm hearing. I didn't think that they should have settled. but that's sort of water under the bridge, you know. Ian thought it was okay, I didn't. Anyway, it's not really a question, just a comment.
Okay, cool. Joan, you raised your hand. Go ahead.
Hi, thanks. I have not really understood about what the outcome of this $500,000 study is. I continue to be concerned about cumulative exposure in the community. And I thought that the settlement agreement was going to perform a health study. And I'm not seeing any reference or experts that are on the team that are bringing forward a health study. You have got Denver, who has never been aggressive about any particular chemicals being released because there are no standards for chemicals. There are odors, and that's all the community can say is, I smell something, but there are no standards for that smell. So I wondered, are we really dealing with the potential of folks who are it's important to have epidemiology, but that was not what I thought was going to be proposed. Would be the community has had other health studies that GES performed, had monies for a health study. National Jewish has been there for a health study. Even the Vasquez Boulevard, air quality bad air does not have operable units where, but people certainly are exposed that are closest to sources. So that's what I'm saying. Has this gone on for a couple of years already? And it was supposed to be a 4-year study. And now are we 2 years? Maybe I'm totally off the mark on that. But as I said, I was looking for a health study, and cumulative health risks have not ever been completed. And EPA doesn't tell you that they can do it. They tell you that we just can work with maximum available control technology, and that's the key to help reduce exposure in environmental justice communities. But they don't tell you what the risks are pulling all these chemicals together and if the community is impacted. Thanks.
All right, I'll give some time for answers. And then if we have more questions, because I don't want to pile them up too high. So yeah, whoever of you want to address whichever questions from the members, that'd be great.
Well, I think we can start in a couple of different places. And I tried to write down all the answers. I may not have got all of them. So if I haven't, be sure to circle back. So first, I think there was a comment made that there are certain limitations that were, there were certain guidelines that were set in the settlement, and that is what we're working with. So it's $500,000. That's what we have, to be able to pay community council members ahead of time of having a PI on board. We had to write a letter to CDOT and to the, lawyers that argued the litigation to be able to release those dollars. So to even spend $6,000 to pay community members, we had to do that step early. Second to that, we had guidelines of what, and I think Melinda had a slide about this in her presentation, of what the study could and could not look at. And so there are certain things that we included in the RFP that had to be in there. And there were other things that we did not include in the RFP that we couldn't include in the RFP. And then there's the last limitation of $500,000, which gets you only so far when you talk about a health study. And this is just me talking as a public health professional and having funded lots of these things in a lot of different ways. It gets you so far in looking at community health risks, and it gets you a lot, but it doesn't get you, that far. And so I think what we have in the way of a health study is that we all know that, and it's been pretty well explained, that there's been lots of studies done in GES. And so one deliverable at least is a proper accounting of what has been done, at least an aggregation of that, a way of packaging that and working with community to understand that, and a way of equipping community with a tool, this website, such that they could use that to hopefully, and I do say hopefully because this is a goal of the study, that it can be used for ways that community would like to use that, whether that's advocacy or whatever. So hopefully that answered a couple of different questions. I know I sort of went with a broad stroke there. Some other questions that I know came up is, how has outreach to the GES community happened currently? I came onto this steering committee about a year ago, and I know that there has been outreach through a variety of forums in different ways that CDPHE reaches to community, different ways that the city and county of Denver reaches through to community, different community groups, and then also, you know, obviously word of mouth. Anybody that comes to a monthly meeting, we say, here's our next monthly meeting, please invite who you would like to come. Participation in those monthly meetings has been meandering. It fluctuates. And I think Melinda's point is a salient one, that we are now moving into a time when we have some really important things to discuss, such as the other really good question, which is, how are we going to recruit community members to the community council? And will they be made up of members from all of the neighborhoods? How do we do that? And we don't want to answer that question. I don't think that's ours to say how we do that and do that in the best way. We would like community and community members to come to those meetings and help us so that we ensure that we have in our contract with a PI a good process for doing that. And so I think these monthly meetings are an opportunity to do that. So if there's a better way to reach out to community, we are all ears. We want to know how to do that and do that better, and we would welcome that. What did I miss? Help me. Or other steering committee members, if you know of a question that I missed that you'd like to answer, please.
I think just maybe talking about the nature of the study itself. I mean, that's what everybody's wanting to know, what's going to happen here, and rightfully so.
I'm sorry, I don't want to interrupt, but that's not what I think everybody wants to know. I want to know why there hasn't been anything signed that this is that there could be a potential conflict of interest, and how their results or whatever they end up producing, that's going to stay at CSU. It's not going to be, it's not a deliverable for the community. So it becomes a way for CSU to have money to start this data set, this dashboard essentially. And it's literally just that, like you just said, that was a better put definition. It's a cataloging, and that does make sense, that now we can see what has been done, but that just becomes sort of a history, like an archive of, like, this is what we've done, these are the studies. And again, some of those studies we've already heard from whistleblowers that they have falsified information. So if you're collecting this data, it's already falsified and horrible. And then that's part of that informs this. This isn't even really a study at this point. It's actually sort of a literature review of the data that's out there. It's a kind of an annotated bibliography, if you will. And then again, it's kind of hurts a little bit on my side, just thinking about, you're sitting here struggling about, I don't know how we're going to do this community thing. I don't know what we're going to do. How are we going to community, when there's literally community right here, and there's so much, and if they're going to have to work at that, trying to find the community, and I just feel like this is not the right, this doesn't capture, I believe, what people actually want.
Rachel, I wonder if you'd be open to actually hearing from the community members who have been working now for years with the steering committee and receiving compensation from their work. I mean, Sandra is here to hear her perspective, because I've heard a lot of voices who are not necessarily community members speculating about that. And I would suggest, we have folks who are members of the community who are present on the call, and maybe we could create some space to hear from them.
Want me to say something?
Hello.
Hey.
Hi. So yeah, my name is Sandra Ruiz. Well, I was just waiting because I don't know if they wanted community members to be involved in this meeting. We have Patricia and Rosie also part of the community council. We have Angela and Adrian who were part of the community council as well, who were working with us also. I've been in this since the lawsuits, and we already know that we lost 5 of them, and the 6th one was a settlement, which I can say I wasn't very happy about it, but I can understand also the plaintiffs, they were exhausted. And yeah, they settled for this amount of money. And I know it is not much, but that's how we got involved. At the first meetings with the steering committee, I really wanted residents to be involved in this health study. There was no community council involved then. So we were figuring out how can residents be more involved and how residents can really know what they're doing to our neighborhoods. And that's because we don't believe anymore in any data or any studies that are done in our community, because we don't even have the data. I know they're always talking about data, but we don't see that data as residents. So it was very important to have residents involved in this health study. And that's how we really push as residents to have a community council. And so we've been working to create this community council. Megan and Melinda have been there working really hard beside me to get this community council together. We had neighbors from Global, Leary, and Swansea. Some neighbors couldn't be part of the community council, but we're still looking for more residents as soon as we get the PI. And trust me, I know you guys don't trust this. I don't trust this, but that's why I'm working directly with them to be able to have a voice there and to say what we want to see, what kind of studies we want to see in our neighborhoods. And we have really good leaders who are working really hard. They come to every meeting. We had some workshops for them, so they knew how to be able to be more of a voice for this health study. And the health study is just gonna start. It's not like we already have the study and everything is done. We've finally got a PI, and we haven't even met the PI. We're gonna meet with her, and hopefully we can start working on everything we want to see in a community. What health studies we really want to see, and that's why we're here, so we can see that they're doing their job right, because we already tired of not seeing that happen in a neighborhood. And it's been a real a process, you know, and sometimes, trust me, it's been really stressful, because it's been hard to get a good solid group and everything, but we already have a solid group right now of women from Global, Leary, and Swansea. And when we planning to get more people from Global and Elyria, for now we're just waiting for the PI, and we're not ignorant, we're not dumb or anything just because we're Spanish speakers or because we are Mexican. No, we know what we're doing, and that's why we push really hard to have a community council, because we want to be there when this health study is being done, and we want to see how it's going to be done and how we want to be it done. So I know your concerns, and we have the same concerns, and that's why we're doing this. And now that we have doing these walking tours, these bus tours. We haven't done the bus tour because I just asked for the bus, but we're doing these walking tours, and we just inviting people to come and know more about our neighborhoods, because it's really nice to talk about neighborhoods. Yeah, we all know we're contaminated and we have contamination and everything, and we're fighting to stop the contamination, but we don't take the time to come to these neighborhoods and walk in these neighborhoods and know our neighborhood. So that's why we're doing these walking tours right now, so you guys can come and know more about our neighborhoods. And I mean, if you have any questions, just ask me. I've been since the lawsuits, involved. And I'm very thankful for to Joe Minor, because he took the task that the last attorney didn't want to take anymore. He was exhausted too. And I'm really grateful to Sierra Club, because they came in and the settlement was already done. So there was nothing much to do. But now we have the settlement, we have this funding. What can we do in the future? What can we do for us?
So Sandra, that's the thing though, like you're saying, we want to be here to have a voice in the study and what's going to be done. It's already been like the PI, that's already been they've already, like, this is the proposal. And I mean, had there not been any community input, they would have gone through with it. Like there would have been, without any more community input, that would have already happened. And this study isn't a health study. It's a cataloging of all the data that's happened so far. And so, I mean, for what I am presuming the community council role, your role would be to work with community to let them know where to go to the website and to like communicate in that way. And so that like, and again, like I would never ever denigrate the work that you're doing and the community council. And also like this amount, like, oh, it's only $5, yeah, it's not enough, whatever. I'm not even questioning that, you know, it's all theater at that point. But then like what are we going to get with our little $500,000? What are we going to get out of here? What's this community going to get? Angela, you have your hand up, sorry.
Yeah. Thanks. And I just want to say I was a community council member. I have lived in Globeville the majority of my life, and I wanted to get involved with this because public health is my background. I had to leave because I'm going to be frank, and I was frank with Melinda about this. I don't see enough equity in this. I know at the beginning when community was being asked to participate, there was not a whole lot of outreach. And I'm not trying to pick fights with anybody. I'm just speaking my truth. And I know myself and 2 other people who live in Globeville tried several times to be able to try to get on the council. And finally, Drew Dutcher was just like, here's the contact information, just get on. And so we did. And all 3 of us dropped out for our various reasons. And, you know, I have to go back, Tristan, I don't understand. Again, once we get the data and the website set up, what are we supposed to do with it? I really, truly don't get what we're supposed to do with it. We know that we are the most contaminated neighborhood in the entire country. What are we supposed to do with this? I mean, it can help some community organizations apply for grants. I understand that. But then what? I mean, I know people in Globeville, because I can only speak for my own community, who don't even want to know this information because it scares them. They don't want to know that reality because it's frightening for them. And where can they go? Where are they going to move? They don't have the monies to move someplace else. So to have all this data is good and it's bad. But as Rachel said, it's all still going to sit in one place the way it did before. It's going to sit in that website. It's going to sit there. And what is it supposed to do? What are we supposed to learn? What are we supposed to get? How do we find out more? And this is something I brought up in the meeting last month. What about our health? How does this help us with our health? Those of us who, on my block, there's 4 households that have asthma. 1 has COPD. How is that going to help us do that? How are we supposed to get the data for people who have asthma, COPD, cancer, etc.? How is that data sitting there going to help us resolve anything when we live here and breathe this air every single day, day in and day out? And I probably have more, but I'm going to stop right there because I'm getting hot underneath the collar. Thank you.
Okay, we only have a few more minutes left. So whatever answers you have based on those questions would be great.
So I think for me, The importance of the community council just continues to be emphasized and actually getting this piece right. I really want to highlight the amount of work that Sandra and the other leaders who have planned the bus tour have gone through over the past couple months, because it's that type of organization and having conversations that raise the concerns that you've mentioned, Angela, having residents talking about those things and having them also partnered with a PI and a visual interface that aggregates all of this data, having all of these things actually come together is going to be the thing that I think answers a lot of the impact, or answers a lot of the interests that people have voiced over the past 2 years leading up to trying to get this study kicked off. So it's going to be a lot of joint effort and organizing. So I think we're going to just have to keep checking in on how to make sure this community council piece gets captured correctly in the scope of work moving forward.
I believe Angela had her hand up, and then Bridget. Go ahead, Angela.
Yeah, sorry, I was having a hard time finding my unmute button. Can you explain what the bus tour is, how it came about, what it's supposed to do? Thank you. And I'll put my hand down because I forgot.
Yeah, I can speak a little bit to that. I've been working with Sandra and several of the community members for most of the summer. The idea of this came out of discussions early on when the incipient stages of the community council, through yourself, Angela, and Gail, saying that this might be a good way to share issues with what's important in the community, what do people like, what don't they like, where are places to share with these interested parties that want to study us, or how might this also be a way to have people understand more about this place, how special it is. It's an amazing little set of neighborhoods here. I've been spending a lot of time there during the summer. I don't know everything about it, but I certainly have been welcomed in a way that has been quite remarkable in working with this group of women to identify all kinds of different points throughout these neighborhoods, to tell the story of these points, churches, schools, sites that aren't so nice, sites along the river, places in certainly I-70, the train tracks, the issues with the train tracks, the pedestrian overcross, the Washington corridor, all of these different areas, and being able to tell a story about these places and share this in the first place with the PI, giving a PI a good view of what these neighborhoods are like, and being able to walk around in them and kind of get a sense of things and walk around with community members who tell their story. So does that answer your question, Angela?
Sure.
I also really, and Bridget, because I really want to wrap this up, or really want to put this point out here. No, I don't know why. I mean, I appreciate, Megan, I appreciate you highlighting Sandra's work. I think we all know how brilliant she is. And we know that our community works their asses off for the health of this community. And I didn't even question one time about what the workload has been about the community council, or ask 1 second about if, anything about them, any critique about the community council. I think the only thing I said is that they probably aren't getting enough money. I mean, and so the work, Sandra's work is impeccable. And I don't want that to be put out here, because I think by mentioning that, it kind of sets up these divisions between us. And I don't think that that's necessary. What I do think is necessary is actually answering the questions about the content of this study and what the actual merits of it are. That doesn't get at all discussed. And that hasn't been discussed in this platform, or just like, what are they going to get? What's the health? Like, none of those questions have been answered. And so thank you, Sandra. You have done an amazing job. I've appreciated being in solidarity with you. I think that does
I
your
just
background.
would like to respond to that, Rachel. I think something important to think about, as we've mentioned, is we're really in the incipient stages of getting the scope of work sorted out. We're going to have further discussions about this. We're going to talk about this tomorrow night. And so I would encourage those of you who are interested in pursuing this and wanting to tease out these details, which are so critical, to come to these meetings and we can continue the dialogue. But it really is, we're at this point where we're trying to develop the scope of work in conjunction with CDPHE within the confines of the contracting structures we have to work with, and then figuring out what it is this, what the details are with respect to these very questions that you're asking.
Okay. Bridget, then Yadira, then Joan. You're on mute, Bridget.
I think the frustration for the community is these people who live, and I don't live so far away from the community, although I'm not so impacted, but they know that they're sick and they know they're dying and they know what's poisoning them. And to think of 4 more years of collecting data, even old data, not even new data, what good is it going to do for them? Is it going to help their children who are terribly asthmatic, or their grandmother who's dying of cancer, or all of these issues, transgenerational health issues? I mean, it's pretty frustrating. And so from the very beginning, the CAG has, of course, is not a part of this, and we're happy to provide a forum for the community to discuss it. But I think as investigators, you have to understand the frustration of this community. Yadira can speak to this. Mary can speak to it. I think all the community people can speak. They know what's killing them, and they know why they're sick, and they want something to happen to change it. And I think the frustration is that this study probably is not going to change it fast enough, if at all. So, but I applaud you all for your efforts, and I know you're all well-intentioned, and so we all do the best we can.
Yadira, Joan, and then Yadira.
Oh, Yadira, she can be first. Is that
go ahead,
okay?
Yadira. Go ahead, Yadira.
Thanks, Rachel. Thanks, Rachel.
Unmuted, Mom, go ahead.
Okay, can you guys hear me okay? Because I'm doing this 3-way and I don't.
Yeah, we can hear you fine.
There's gonna be some snare echoing in the middle of this, but thank you, Bridget, for that, because this is very true. You did say something that is very concerning to myself and my family and a lot of people that I do know. And I'm just trying to figure out, like some kind of a middle ground on towards where this, this information that it's already there, and they're going to just upload it into a newer system so it could be accessible for the community. If instead of it being called a community assessment, it could be a different name, so that way it doesn't confuse the community that it's actually doing something more than what it is doing. And agreeing with Rachel, that I don't discredit Sandra and the hard work that it is, because it is hard work. It is hard work to be a community activator for the community. It takes a lot of time. It takes a lot of time away from your family, and all of that. And to the bus route, I think that it's probably a good idea if you wanted to show the community or whoever wants to come and see the neighborhood on what are the things that are going to be needing to be looked at or placed. But I think that we're not focusing on the true facts here, and the facts are that I don't even think it's an assessment. That this project that you guys are doing really doesn't have a point at the end, other than making sure that the people who want to know what are the contaminants for other people, because I'm sure that there's a lot more people in the community other than myself that want to know what is really killing them. Like Bridget said, if they wanted to reach it and it would be more accessible, that would be a great thing to have. I just wish that there was more to this than what you all are doing. Thank you.
Thank you.
Yadira, Would it be okay if I responded to that a little? That this is Joel.
Go ahead.
Yeah, I think if it's okay, I will maybe take off my hat as a current CDPHE employee and put back on my hat as the attorney who represented the community groups and negotiated the settlement.
Is that
It feels
possible?
like, well, I'll just share some thoughts. Obviously, I can't.
Joel, let's be clear about who you represent here.
Sure, I represent CDPHE, right? But I'd like to share some thoughts that are not about my current job at CDPHE and just get to kind of how did this study happen and what is the core purpose? Because I think a lot of the feedback I'm hearing relates to that. And I would just say I did, as has been stated in emails, right? I came in as the lawyer towards the end of the process after my predecessor attorney had already fixed a value for the dollar value for this health study and the fact that the health study would be part of the settlement. And based on the input from my clients, from community members, we really did push for a lot of other things that are in the settlement that are not this health study, focusing on many of those other things that have provided real gains for the community, the vegetation that's being planted around I-70, the tree planting project, the monitors that actually do help construction.
Well, I'm sorry to cut you off, but this is going off on a tear, and we're over time right now.
Sure.
And Joan has asked her question. Just whatever, like the actual questions about what
Sure.
this is. Yeah.
So I would say is this was never intended to have $500,000 solve the full scope of problems that I think everyone's bringing up, but to be a start, right? And so I hope you'll give it a chance to be that start and be what it's intended, which was what the plaintiffs, the community members wanted as a first step towards cataloging all that data that is there about their community and that was already starting to be there when we negotiated the settlement, and be a bridge to future actions, right? It was never intended to be the final be all, right? And it was part of a broader package in litigation. So I just hope you'll keep that in mind, like on behalf of the people I represented in the past, that it wasn't intended to have this broad scope. And I hope you direct any frustrations about the scope of the study and the scope of what it is appropriately to me and to my former clients, and not to the people who are trying really hard to make this study happen and provide community input now, right? I think that's what I'm trying to say.
Okay. Joan?
Scope of the study. I still was confused about really what is the mission? What is the mission statement? And I wanted to see something that gave me assurance that where I know many in the community believe that there would be a cumulative health study, nothing that's ever been done. This community has had health risk assessments. They have had many health risk assessments that have been completed to say, well, there's nothing wrong. And Denver, who's on this committee, has been very involved with studies that question odors. How are you going to tell the community anything if we don't really get down to what's being measured, what's being monitored, what is legally being monitored? And currently CDPHE has had the right, if they wanted, to regulate certain chemicals if they wanted to. And maybe later on Joel can speak to that. But when you don't have location, that means when you are sitting next to an industry that's exposing you, that there is no study. Interestingly enough, those studies can include monitoring. It can include the oh my God, when I'm getting old, so I can't remember when you do modeling, for God's sakes. Modeling. Oh, well, modeling is not a good word in the state of Colorado right now. If you took these industries that are sitting next to the community, have they done the modeling? And we shut down an $80 million trash plant when the modeling was completed by EPA, not CDPHE, but when EPA would actually complete it. So I'll end there, but I wanted to understand, is the mission complete? I understood that there's a bus tour, and Denver has produced an incredible document on what's already in GES to be proud of, and they're a very proud community. But as Bridget brought up, this is an unhealthy community with acute exposure going on. And so they really want to know, well, where's the data on the chemical exposure? And so I think they have a right to ask that, but after 2 years, has the mission changed that there is no health study, not an epidemiological study gathering a bunch of data? Where is the health of the community where you can't breathe and they're getting cancer and there are just so many health impacts? There's a reason they were one of the highest rated Superfund sites in the country. So, you know, you're starting out with the beginning of what's gone wrong here, and we're back to not really understanding what's wrong. And I didn't understand why CSU is now, Rachel, maybe you can explain, why is CSU going to be holding on to this data? I'm a little confused about, this should be distributed to everyone. So we can take maybe those 3,400 people that didn't want the study, have them assess this after it's done. So is it a health study, or are we doing epidemiological data gathering?
Right. And I'm happy to talk more with you, Joan, about it.
Thank you very much,
essentially-
Rachel. Sorry about that.
Yeah, that's fine. No. And I mean, yes, this is really the crux of it. Like it's a cataloging. It's not what is the actual study? What are you studying? You're not studying anything. You're actually just cataloging. And I think that's where we're really kind of, where is that within that information? It's basically going to create this dashboard that is now property of CSU. And it's a data dashboard that they've created it. So then now they have a data dashboard that they can put on their website and say, this is the information that we have, this whole interface that people can use. And you can, I mean, people can use it. Yeah, our community can actually go in there and get on their website and use the data. But that's kind of the product essentially. And the data that they're using has already been whistleblown about. So lots of problems and issues. And it's really late and we got to go. And I'm so sorry that this is our ending and it's not graceful at all. But I think what would be useful, I don't know if you all are interested in this or would be open to this, but like, if we give you 1 or 2 questions, could you please reply back to those? Reply back to the CAG about the answers to those? Because yeah, I think maybe you need to go ask the PI, the people who have put this proposal forward, to get a little bit more clarity yourselves. I'm not sure. Would that be?
That's one of our aims is to make sure we answer questions and clarify things. So please do send your questions. And as I said, please come to our meeting tomorrow night where we will be discussing more of these things and continue the dialogue. This has been very helpful, and I appreciate all the comments that people have had to share this evening.
Thank you so much. We appreciate your willingness to be here. And then, as you know, I just want to remind people about our meeting next week or next month. And then also just encourage folks to go to the meeting tomorrow night if you can, if you're able to. All right. Have a good night, everybody. Thanks for joining us.
Thank you, all of you, for being here. Bonsoir. Goodbye, Tristan.
Sorry. Bye. Thanks.